Good morning. Myself Dr. Swaroop. I'm a consultant dermatologist. Today I'll be briefing on what is acne vulgaris. Acne vulgaris is defined as chronic inflammation of pilosebaceous unit. So what is this pilosebaceous unit? In our skin, there's upper layers called as epidermis and the deeper layers called as the dermis. So in the dermis, there are glands. Like sweat glands, there is something called as sebaceous gland. These sebaceous glands are maximally distributed over the face, on the forehead, the cheeks, the chin, the chest, the shoulder, as well as the upper back. These sites we consider as acne-prone sites. The sebaceous gland will produce sebum, which traverses through the sebaceous duct, gets connected to the hair follicle, and it will discharge out through the pores. What we call it as follicular ostium. So this entire unit we call it as pilosebaceous unit. And when there is infection followed by inflammation of this unit, we define or what we call it as acne vulgaris. What is the major factor for causing acne vulgaris? The major factor is one is androgens, what we call it as testosterone. So soon after puberty, males and females, the androgens will be secreted or released. So this testosterone goes and stimulates the sebaceous gland to produce more of sebum, which we call it as seborrhea. Next, once there is excessive seborrhea, at the same time there will be obstruction to the outflow of sebum. Like in the hair follicle, there will be excessive accumulation of dead cell, what we call it as keratin. So this blocks the outflow of sebum. So when such an environment is created, this accumulation of sebum and keratin forms a good nidus for the bacteria, what we call it as Propionibacterium acne. It starts proliferating. So when it starts proliferating, the different cells in our epidermis will identify it and will mount an immune response. So the host defense will mount an immune response. So there is infection followed by inflammation, which results in acne. So this is the main factors. One is the role of antigen, role of bacteria, and the role of inflammatory cells. Other than this, other factors are, for example, genetic factor. If the parents had history of acne, then chances are that children also can have acne. So that is genetic factor. Other than this, medications. It could be topical or systemic medication. Topical medications, for example, use of topical steroids, what we call steroid abuse, topical steroid abuse over the face. So that can induce acne, or use of inferior quality cosmetics or cosmetics which is quite oily. So usually the patients might use it frequently, rubbing it or massaging it over the face. This can trigger acne. Among the systemic medications, one is anabolic steroids. Usually the guys, when they go to gym to boost or to bulk their muscles, they can take these anabolic steroids. This can induce acne. Or among the other medication, for example, in anti-tubercular drugs, isoniazid. So it can induce acne. Or in females, when they use oral contraceptive pills, that can also induce acne. Other triggers are, for example, the diet. Especially the dairy products, they are considered as having high glycemic index. Dairy products means milk products, milk based, like paneer, sweets, cheese, pastry. So these are made out of milk. They consuming it in higher quantity can induce acne. Other triggers, for example, seasonal. So we see acne more, we come across acne more in summer season. The reason being, in summer, because of the heat itself, it stimulates the sebaceous gland to produce more of sebum. Second, because of excessive sweating, these can block the pores. So this can induce acne. So truncal acne sometimes we see more common in summer, and this is the possible reason. So these are the etiological factors as well as the triggering factors which can induce acne. Next, how do we grade acne? So we grade acne based on its severity. So when the patient presents to us with acne, we grade it based on its severity. So grade 1 acne, we see more of comedones. Grade 2, we see more of erythematous papules. In addition to comedone, we see more of erythematous papules since the infection has set in. Grade 3, we see more of pustules and nodules as such. Grade 4, we see more of nodulocystic lesions. as well as the post-acne sequela, that is scarring. So scarring we see more commonly in grade 4 acne. So based on the severity of acne, we base our treatment. So in grade 1 acne, since there is more of comedones, there is no role of any infection, we give more of topical retinoids. In grade 2, since there is edematous papules, that indicates there is some amount of infection going on, so we add a topical antibiotic. Once the patient goes to grade 3, wherein there is more of pustules, we add systemic antibiotic. For example, it could be doxycycline or minocycline, to name a few, in addition to retinoids. And once the patient goes to grade 3 or grade 3, grade 4 or grade 4 acne, we put the patient on systemic retinoids, what we call it as isotretinoin. So what is the general advice we give to the patients, especially with acne? The first factor being, they need to frequently cleanse their face because there's more of oiliness over the face because of sebori, what we say. They need to cleanse their face regularly, and they have to gently wash the face. They should not rub it or massage it or scrub it, wherein they'll damage or they tend to manipulate the lesion. So they should gently wash the face frequently, at least 2 to 3 times a day. Second factor, they should not fiddle with the lesion. They should not manipulate or try to squeeze the lesion. So it can cause more damage to the skin rather. So they should avoid manipulating it or squeezing it. Third factor, what is the diet they need to avoid and what they need to take? The diet which need to be avoided is, as I told earlier, the dairy based products, they need to avoid it. Which is the diet preferred for acne? So mainly it is vitamin A rich food. Anything which is yellow and orange in color. For example, in vegetables like carrot. Among fruits, it could be orange, sweet lime or papaya, which is rich in vitamin A. So vitamin A rich food we prefer when the patients are having